Hello friends. Today we are going to discuss about IQ assessment as per the recent Gazette notification 2024. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about the recent Gazette notification which was done on 12th March 2024 regarding IQ assessment. In this Gazette notification, they have discussed what are the tools to be used, how to use, and when to use. I'll also be discussing about what are the positive aspect and negative aspect of this Gazette notification. As I mentioned, on 12th March 2024, the Government of India came up with a recent new guidelines for assessment of disability. In this regard, for developmental disorder, a subcommittee was also formed under the chairman of Dr. Shifali Gulati. She is the child neurologist and a professor working at Department of Pediatrics, AIIMS, New Delhi. In the whole, the Gazette notification, they came up with the list of tools which can be used for RPWD Act for the assessment of disability. They also mentioned what are the tools which are available freely and which are copyrighted. And this notification was done under the Right to Persons with Disability Act of 2016. With regard to IQ test, which is mentioned in the page number 522 and 523. I am here giving page number for simple reason is it is around 800 plus pages of notification. That means you have to sit and search where is this IQ test, how to do it, and where you have to find. Hence, I am giving the page numbers. They have mentioned certain set of tools. With regard to IQ test, they have come up with VSMS, which is Vinland's Social Maturity Scale, which is copyrighted. The next one is Malin's Intelligence Scale for Indian Children. Again, it is a copyrighted. The next three, which talks about Wechsler's Scale for Children, Edition 4, again a copyrighted. Binet-Kamat test, again copyrighted. The only one which is not copyrighted is NIPD IQ test, which is freely available. That means they have named 5 IQ tests which can be used for assessing disability with regard to of IQ test. That means intellectual disability. With regard to SLD, there are two important tools have been named. One is Niman's Index for SLD, which is copyrighted. The second one is Grade Level Assessment Device for Children with Learning Problems in School. It is called as GLAD, which is freely available, but unfortunately, the assessment of SLD is for till the standard, 4th standard only. Similarly, with regard to autism, they have mentioned about Incline Diagnostic Tool for ASD and Indian Scale for Assessment of Autism, which are freely available. And finally, ideas for mental illness. Now let's discuss about intellectual disability. As per this Gazette notification, page number 489, intellectual disability is defined as a condition characterized by significant limitations, both in intellectual functioning, that is reasoning, learning, problem solving, and in adaptive behavior, with onset in the developmental period and which covers a range of daily social skills and skills required for activities of daily living. They have given this definition to clarify. The term intellectual disability will be reserved for children with age 5 and above. Then what happens to the children below the 5 years? If there is any delay, then it will be considered as global developmental delay. That means you will use intellectual disability only for children 5 and above years. Now let's look into the screening. Whenever there is a doubt with regard to education, academics, or understanding, either the parents or the children or the teachers may complain about the children. And the children may also be screened in the hospital or maybe in the school. Children in such and sometimes will be seen in the OPD side, that it may be pediatrics or some other clinics. And then they need to be referred to pediatrician. The pediatrician will look into the various neurological comorbidities and he will do the detailed assessment. Further, he will look into whether the child has any visual difficulties, locomotor difficulties, or hearing difficulties. Why this is very essential? Imagine if the child is unable to see properly. Invariably, it impairs his academics. At the same time, if the child is unable to hear properly, again, it will cause difficulty in answering questions. Hence, the screening is very essential before we move for IQ assessment. That means before you do IQ assessment, you need to get the important clearance that the child does not have any eye related problem and hearing related problem. Now, further, the screening is divided into two. The first one is for children between the age of 1 and 5 years. In such a scenario where there is a delay, VSMS should be used. That means VSMS profiling has to be done. And if there is any delay, that is impairment in more than two domains, equal or more than two domains, then it will be considered as global developmental delay. For the child equivalent to 5 and above will be used either VSMS or BKT or MISICS will be used. Here the intellectual disability will be the definition, and finally, irrespective of the age, we will be using severity assessment of VSMS for knowing the percentage. I'll be discussing about VSMS score and the disability percentage. That means, my dear friends, you have to be very clear whether you are dealing with a child less than 5 years or more than 5 years. If you are dealing with a child less than 5 years, then you are going to use VSMS, which is there in Appendix 6. Unfortunately, that Appendix 6 is only a 3 line which has been mentioned. These children who have at least 2 or more domain, if there is a delay, then we will consider it as global developmental delay. Below the age of 5 years, a temporary certificate has to be issued telling that the child has global developmental delay. This certificate is valid up to the age of 5 years. Once the child crosses 5 years, or else the first time the child reports, maybe at the age of 5 years or more than 5 years, then you will be using various tools to assess. The tools which can be used for adaptive functioning and IQ may be VSMS again, Binakamat test for intelligence, Wechsler's intelligence scale for children, Malin's intelligence scale for Indian children, National Institute for Empowerment of Persons with Intellectual Disability will be used. Again here, the Appendix 7, 8 ABC has been mentioned. The certificate which is issued at the age of 5, if the child has more than 80% disability, in such a scenario, the certificate used or issued at the age of 5 years, that means the reassessment and recertification will be done only at the age of 18 years. Once it is done at the age of 18 or more, that will be valid for the lifetime. That means if the child has more than 80%. If the child has less than 80% disability, in such a scenario, if the assessment is done at the age of 5 years, it has to be redone at the age of 10 years and again at the age of 18 years. Once the assessment is done at the age of 18 or more, that will be valid for lifetime. If you look at the disability calculation, irrespective of the age, the disability calculation will be done based on the VSMS score. That means the other test what we are using will be used to concur the diagnosis. If the VSMS score is between 0 to 20, it will be considered as profound and 100% disability will be given. If the child scores the VSMS score between 21 to 35, then it will be considered as severe and the disability will be 90%. If the child scores between 36 to 54, then it will be considered as moderate and 75% disability will be given. If the child scores somewhere between 55 to 69, it will be considered as mild and 50% disability will be given. If the child somewhere scores between 70 to 84, it will be considered as borderline and the 25%. That means if the 25% is given, the child will not get any benefit because the 40% is minimum has to be scored for social welfare measures. Now the question is, who will be involved in the assessment? There are 4 important people who will be involved. One is the chairperson. The chairperson shall be the government official. He will be the medical superintendent or the chief medical officer or civil surgeon. The rest, the pediatrician and or the pediatric neurologist, if they are in the government, fine, or else they can be summoned from the private. Further, the psychiatrist, or the child and adolescent psychiatrist. If they're in the government, fine, or else they can be hired from the private. Similarly, clinical and rehab psychologist. This notification is very flexible with regard to having the chairperson being from the government and rest can be hired because, as we know, these pediatric neurologist, pediatrician, child and adolescent psychiatrist, and psychiatrist are very rare species in India. That means they are very difficult to be found in the government sector. Invariably, they are been working in the tertiary centers. That means issuing certificate at the community health center, taluka level, and district level is very difficult to get the assessment done. Now let's critique about this Gazette notification. Yes, this Gazette notification has been very clear and they have listed all the tools which can be used for IQ assessment. They have clearly mentioned which are free tools and which are copyrighted tools. They have given the permission to onboard private psychiatrist or child and adolescent psychiatrist except the chairman. That means it is a very progressive thinking in terms of helping the patient who has intellectual disability, and many a time they have to come multiple times to get the assessment done. If you go to tertiary centers, invariably the waiting period is somewhere 6 months to 1 year. That means that is the uh, things which is happening at metropolitan cities. What about the district hospitals? Many a time they do not have the tool, or else they are unable to assess because they are not been trained. Further, invariably they have mentioned about VSMS is mandatory for assessing the disability. Unfortunately, it is a copyrighted one. Who is going to buy? Is it the government servant? Or else the charges will be on the patient. Please understand, Right to Persons with Disability Act of 2016 is a rights based, which is claimed against the state. That means the state has to buy the copyrighted version of VSMS and train the psychologists who are working in DMHP. That means, my dear friend, this copyrighted version has to be brought by the state government. Invariably, VSMS has been mandatory. Not only that, 4 qualified person in the medical authority is unreasonable according to me. Earlier PWD Act required only 3 people. Now you have made 4 specialists to be there. And by chance, if they are not available in certain states, especially maybe northeastern states, clinical psychologists may not be there. Psychiatrists may not be there in all the districts. That means they have to come to the capital city to get the IQ assessment done, and they have to travel 5 to 10 times to get the certificate. That means, are we talking about a Right to Persons with Disability Act, or else a charity which is done by the state? That means we should understand what is the ground reality and we have to write this Gazette notification. Unfortunately, they also mentioned about 3 assessments which have to be done by different people is not required. Not only that, if a person is scoring less than 80%, he has to get assessment at the age of 5, 10 years, and 18 years. That means already getting one IQ test is very difficult. You are asking for 3 tests is unwanted, unwarranted. If the IQ test is done at the age of 18 and above, that can be valid for life. Unfortunately, the reality is not being kept in mind. 3 assessments is not required. If you look at the page number 532, Appendix 6 talked about VSMS, but it is a copyrighted. That means they have mentioned the user may follow the due process. What does it mean? That means the person who is assessing has to buy this, or else will the state do it? That's the question, which is $1 million one. Similarly, Mellon's intelligence scale for Indian children is also a copyrighted one. Similarly, Wechsler scale for children. That means whoever is going to do, that means their users may follow the due process is the word has been used even for Binek Ahmed. Finally, we have to use only NAPID IQ test. Wish they would have told only NIPID IQ test, telling that it is freely available, that can be used, rather than giving the list which are copyrighted. To conclude, my dear friend, the Gazette notification appears to be very good. At the same time, it is 800 pages. And anybody, especially even the professional, finds it difficult to find where is disability assessment for IQ, where is the appendix, Which are those scales? And some of them are copyrighted, some of them are free. And for the copyrighted version, who is going to buy? That has to be answered by the state. Training of the government district mental health program officers has to be done at the earliest. The committee never considered availability of resources for assessment, especially with regard to Gazette notification. Thank you very much for giving your valuable time. Stay safe.